We all have a need for belonging, and some people tend to elicit this so easily, and others, unbeknown, push others away. Is there something common to communication styles that elicit either acceptance or, on the other hand, rejection? And how can you help a client identify this in the therapy room? Welcome to The Art of Therapy, Season 2, Episode 18.
So we're back again in the studio and just further exploring the art of therapy.
Yes.
Yes. So just to recap a bit about the last episode. So the last time we really started to explore another very important factor that has an impact on our mental health. And that one was to look at to what extent does a person or the people in the environment, to what extent are they able to adapt, to change, to alter their behavior, to fit an appropriate situation. So in essence, we looked at the degree of flexibility or rigidity and how that affects our mental health.
Yeah, very much. And we understand that that relates to how effectively someone's able to adapt. And to the extent that they really are flexible, they can adapt from one context, one relationship to another. And to the extent that there's inflexibility or rigidity, the struggle to adapt. And we can anticipate that there will therefore be some difficulties around mental well-being or some distress in one or more relationships if there's some degree of rigidity or inflexibility.
Yes. Okay, so we said that in the last one, we said that there's another aspect or another element that's really important to mental health. And you mentioned that it has something to do with social psychology.
Yes.
Yes, so that we can explore that a bit further today.
Yes. Okay, this has to do with some thinking of Charl Vorster. We've spoken about Charl considerably. And what he had understood or considered is that it's a concept from social psychology, and it relates to someone's capacity to bring people closer, to elicit acceptance, or to some degree pushing others away, eliciting rejection. So what is so important to look at and try and make sense of is the client's capacity to generally bring people closer to them, to elicit acceptance, support, validation, or to the extent that they tend to elicit possible rejection, hostility, but effectively pushing people away. And so what this relates to is the degree to which, or their potential, let's look at that more carefully, because it's just one's looking at what potential is there, that they will either elicit acceptance or possibly tend to elicit rejection.
It sounds like a difficult one because it's looking at the behavior and what is the impact of the person's behavior. So it's not about right or wrong or whether you like it or not from a therapist side, but it's to understand a person's behavior and how can that impact other people in their lives. And that impact, does that maybe bring someone closer to them, or does it have the potential to push people away from them?
Yeah, it's so important what you've said, because what you've explained or just clarified is that it relates to behavior. And we know from the communication model that very often there's some difficulty when we're communicating between what we intend and what effect we have or what impact there is. And it's so clear with this that very rarely will someone ever want to elicit rejection. It's a very painful experience. It's hurtful. And we often sit with any such impacts in an interaction. So very rarely will anyone ever want to elicit rejection. It doesn't mean that one or more people won't, or from time, of course, but by and large, there's not the intention to elicit rejection. So very often this is happening outside of someone's awareness, and they just don't know it, but time after time or after a number of interactions, and possibly in different relationships, they begin to experience rejection or pain. Or the converse of that, someone who, whatever relationship they're in or environment, just tends to elicit acceptance, draws others and draws people closer. And so, again, they may not be intended, but there's some aspect about the way they're communicating that's really attractive, that's really likable, or not. And to the extent that we are drawing those around us closer to us appropriately, and we're accepted, valued, even liked at times, that's going to be meaningful. But to the extent that we tend unknowingly pushing others away, that it's going to be associated with rejection and increasing isolation, which can be very distressing.
And I love that you mentioned it's not the intention. It's for most people, it's not the intention to push people away or to elicit rejection. It's because we all, of course, we all want to be accepted. We all want to find our place and to be accepted by others. But it's sometimes it's not our intention, but it might be our impact which creates difficulties.
Yes, so much so. You note that we all would like to be accepted. Yes, it ties very closely to what we spoke about, that we, in interaction, the importance of being accepted. We spoke about unconditional positive regard. And then, moreover, we often have a need to know that we matter, that we count. And we spoke about the need for confirmation. So, yes, being accepted, being validated, confirmed, in a number of important relationships or interactions we have is really key to our well-being.
It's actually a lot of what you mentioned. It's a lot of some of the previous elements that we looked at plays a part in this.
Yes.
Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za.
Yeah, I'm so glad too that you've noted that, because when we're looking at this potential that someone has to either elicit acceptance or rejection, very often we will try to register what the impact is of the way they're communicating, and then try to anticipate on the way in which the basis for which they are relating and having a particular impact. If they do the same thing and communicate in just the same way in their relationships out there in their primary system and with others, what kind of reaction can we expect that the client will elicit? So we will look at it, but once we understand that, very often we're going to note if there was a particular, let's say someone has a very high potential to elicit acceptance, we may notice that how that occurs is through their high expression of empathy. They're very empathic to others. There's a lack of judgment in the way they relate. And when they are expressing their needs, they do it in a way where they not only understand their own needs, but try to understand the frame of reference of the other, empathy, and on that basis then express their own needs. And then if there's a conflict, negotiate that with empathy, lack of judgment, and do so congruently. And if someone does that, generally speaking, we can anticipate, yes, that they're going to draw people closer. People are going to want to be around them, even in times of possible conflict. So when we look at this variable, at this interpersonal quality and this interaction of their potential to elicit either acceptance or rejection, very often we're going to start ticking off various interpersonal qualities that we've been speaking about.
It's really it's an element on its own, but it incorporates a lot of the other things that we've already dealt with.
Yes.
But it's really to have a look at is there eliciting acceptance then or rejection?
Yeah. So you may sort of wonder, well, then if it incorporates other interpersonal elements, why have it at all? And the importance of this is that, yes, it involves all the other interpersonal parts or elements, but with a very specific focus now on that communication, on that behavior. Does it tend to elicit acceptance or rejection? And that seems to be key, another key for understanding emotional well-being in terms of how we relate. So it's a very, very specific nuance to interaction that we would like to understand.
It sounds like it brings a lot of clarity actually to that can be linked to a presenting complaint, the specific variable there.
Yes. Yeah, for instance, if someone, you noted earlier that there's no intention to elicit rejection. So someone may be seeking through the interaction, maneuvering for understanding and sympathy. They may be feeling very down. And so through the interaction and repeated interactions, the interaction is characterized by a very strong need or maneuvers for sympathy and understanding. But if that is occurring repeatedly and that same individual is not showing empathy to others, not showing understanding, and they are seeking understanding and seeking sympathy, that can often have an impact of eliciting rejection and isolation longer term. And here the individual has just no idea about that or no intention. They're just really trying to get and wanting others around them to understand and to some degree give sympathy. We all need sympathy from time to time when life gets hard. But again, if this is a dominant part of that interaction, it will, or it could elicit rejection longer term.
And once a therapist can see that, they can actually assist a client with that.
Yes.
And that can make a massive difference on their mental health.
Yes, yes, indeed. It can be something as simple as, yes, expressing that need for understanding and sympathy, but then at some point being very mindful, very, very intentional, pausing and checking in with the other, or beginning with checking in on the other and trying to understand some of their own experience before moving for one's own need and one's own need for understanding and sympathy. That simple change could be the difference between eliciting more meaningful, longer-term support or eliciting rejection.
Yo, it's just beautiful to look at it like this, and it just shows the nuances of it. But what a massive difference it can actually make in how people relate and how they experience themselves then in relationships and how others experience them in relationships.
Yes. Yeah. That's the beauty of psychotherapy, that it's the safe space that clients can learn about themselves and also receive timeous feedback, because very rarely does anyone get a timeous feedback that is feedback without judgment. And it's done so with acceptance, and it's done so very safely, very genuinely. It's a remarkable thing for someone to be able to test things out, ask for input, receive feedback. And for a therapist to begin decoding the complexity of therapy, which often can seem so complex. And then the moment one understands these nuances and can see these elements, now you can get to work and help your client more effectively. So it's beautiful what it can mean for both client and therapist.
It is. It's absolutely beautiful. Yes. I think just looking forward as well. So we know with therapy, so a lot of people come to therapists when they've experienced some form of trauma. And a lot of the times that's sometimes their first call, or during a therapeutic process, there's some trauma that clients do experience. And I was just wondering, with trauma, what impact does that have on a client, and to what degree should a therapist look at trauma as well? And how does it just affect what you see and how you observe with a client?
This is so important, what you've asked and what you've just highlighted, because trauma has a very, very particular impact in the way we relate. And so that is something that I think we need to look at in more depth, but at the next episode then.
Okay, so we can explore that in further.
Yes.
Okay.
Thank you for joining us on The Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.